Bismillahirrahmanirrahim. Assalamu alaikum, everyone, and welcome to the Canadian COVID-19 Task Force Ramadan Town Hall. Jazakallah for joining us this evening. On behalf of the task force and the panelists, I would like to welcome each and every one of you to this evening's event. My name is Rafaida Mohammed, and I'm one of the co-chairs of the COVID Task Force. And I'd like to begin by asking Sheikh Tahir, who's one of our panelists this evening, to begin with an opening dua. Sheikh Tahir.
Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alameen. Wa sallallahu ala Sayyidina Muhammadin wa ala alihi wa sahbihi wa sallam. O Allah, we ask you, as you are our Lord, to give us an understanding, to teach us from what will benefit us, and to benefit us from what you have taught us. We ask you, Allah subhanahu wa ta'ala, to give us clear understanding, to put truth on our tongues, to put light in our hearts, and to increase us in closeness to you by the words and by the understanding that we speak. We ask you, Allah subhanahu wa ta'ala, to have mercy upon us and our community, to unite our hearts, to bring us to the blessed month of Ramadan in well-being and in health. We ask you, O Lord, that all those who are sick, of our loved ones, of our friends, and of our community, we ask you to give them good health, to bring remedy to them, and to nurse them back to good health. We ask you for those who have passed away, that you have mercy upon them and forgive them, and that you put them in your shade on that day when there's no shade except yours. We ask you for success in this program and to all of us who are listening, and we ask you to guide us, and we ask you to have mercy upon all of our communities and all of our society. Ameen, ameen, ameen. Alhamdulillahi Rabbil Alameen.
Jazakallah, Sheikh Tahir. Thank you so much for that beautiful dua. I'm just going to begin with a land acknowledgement. We start by acknowledging that we are on the traditional territories, Treaty 13A, 1419 of the Mississauga of the Credit First Nations and unceded territories. We are grateful to the Mississaugas of the Credit First Nations as the caretakers of this land, and recognize the benefits that we receive from this land. This land continues to be home for the First Nations community, Inuit, and Métis peoples. We thank them and other Indigenous people who have walked before us and share this land with us. The Canadian Muslim COVID-19 Task Force was established during our first lockdown on March 13th, 2020. As a platform to bring together diverse Muslim, medical, religious, and community leaders and organizations in their response to the COVID-19 pandemic. Through intersectorial collaborations, the task force works to prepare culturally and religiously appropriate guidance and resources that addressed our community's needs during these times of uncertainty. Today's discussion brings together Muslims that are health experts, faith, and community leaders to discuss how we as a community can ensure everyone stays safe during this Ramadan by exploring what best practices can be adopted, answer key questions, and address common concerns that are on the minds of many individuals in our communities. The task force has developed a Ramadan guide, which has taken faith and evidence-based approach to ensuring that Muslims across Canada are able to observe Ramadan in a very spiritually uplifting way while still prioritizing the health and safety of our community members. This document was created after consultation with imams, mosque administrators, community members, medical and public health professionals who had the opportunity to provide meaningful feedback iteratively. You can access this guide at our website, which is www.cmcovidtf.ca. I just want to make note of a disclaimer. None of our speakers this evening on the panel have received funding nor an honorarium. All of the speakers are volunteers and are doing this for the community and for educational purposes. For any individual medical condition that you may have, please seek out advice from your healthcare practitioner. This presentation is not meant to replace the advice of medical professionals. For any Islamic questions, the advice of an Islamic scholar should be obtained for your individual situation. This presentation is not meant to advise on personal religious matters. This talk is for educational purposes only. Information presented in this talk represent current circumstances and current data, and is subject to change in the future, the coming days. The information in these videos, should be consolidated and resourced in the community whenever needed. You can find it on our website in the coming days. I'd like to now introduce our speakers who are part of our panelists. Dr. Noor Khatib is the frontline emergency doctor at Lake Ridge Health and Sunnybrook Hospital. She is an assistant professor at Queen's University and lecturer at the University of Toronto. I have Sheikh Zahir Bakis, who is currently the Imam of Jamaat al-Ansar Mosque in Brampton and principal at Lotree Islamic School, also in Brampton, and is the secretary of the Canadian Council of Imams. Also joining us is Dr. Mustafa Hijri, and he is a public health physician who is specialized in public health and prevention medicine, and currently is the acting medical officer and health commissioner for public health emergency services in the Niagara region. So welcome, everyone. Just want to get started now by asking some key questions that have surfaced, over the past months as we gear up to Ramadan. And these questions are for all of our panelists. I do want you to know that you can pose your questions on our chat groups that are found on Facebook and YouTube. We have volunteers that are constantly monitoring those sites, and they'll be referring those questions to our platform here. So please do take up the opportunity. Any questions that may not be answered will still be collected and posted on our website under the Q&A section. Our first question is geared towards Dr. Khatib and Dr. Mustafa Hijri. Can you tell us a little bit about the third wave? What is currently happening now in our community amongst this third wave? What are you seeing amongst various populations? Can you go into a little bit more detail with regards to the variants? Can you talk about how these are affecting different populations? It's important, I think, to address some of these concerns, as it will affect how we engage during Ramadan publicly. So can I ask Dr. Khatib perhaps to start, and then Dr. Hijri as well to maybe jump in as well.
Bismillah ar-Rahman ar-Rahim. Thank you so much for the invite tonight and for that introduction. To answer your question a little bluntly, the third wave is the worst wave. What we are seeing is what we were hoping would not happen. The first wave was not like this. The second wave was not like this. Unfortunately, in the third wave, we're seeing higher volumes of COVID patients. We're seeing higher volumes of non-COVID patients, which in the first wave, actually, we had low volumes in the emerge of non-COVID patients. And the hospitals are just bursting at the seams. The ICUs are full. The ICUs are transferring people to other cities like Ottawa, like ICUs in Toronto are transferring people to Ottawa, and the patients can't even consent to that. This is how deep into this we are right now. This is how serious the wave 3 is. It's a sad time in our nation to be in wave 3. And I think as Muslims today, we will learn how to set an example and try to help our community get through this together, because we can get through this. We've seen other nations do so. We can get through this, and it's never too late. So we will talk to you about that, of course. We're seeing most of our cases now, over 50% are the variants, right? And we know that the variants are spreading faster, and the variants are affecting younger populations. In our ICU, in my ICU, average age was 51. Before it was in the 70s or 80s. So now it's affecting younger and younger people, and we're seeing 24, 30-year-olds end up in the ICU intubated. And I've said it before, it's a lonely disease, and it continues to be a lonely disease. So we have to take wave 3 seriously, and we have to pay attention to what our medical community, our Islamic scholars are saying about how to be healthy and protected during this Ramadan, inshallah. I have something to share with you here, just very quickly.
Please do.
So just to give you an idea of the number of cases, 1 million cases in Canada. I didn't expect this. When I saw 1 million, I really just thought, like, this must be somewhere else. But unfortunately, it's us. It's in Canada. And the number of doses for the vaccine, 7.5 million doses given. That's it. We're not nearly as close to where we should be. And we're working on it. We're trying with the constraints that we have to get there. But with this picture in mind, we know wave 3 is our worst and will continue to be our worst. So we need to be very vigilant during this time. And we will talk to you shortly about what we can do as a community together to get through this. And inshallah, we will get through this.
Jazakallah. Thank you so much, Dr. Hirji. Any comments on Dr. Khatib's response there, please?
I think Dr. Khatib covered a lot of the really key details really well there. I think everybody has heard much about what's going on right now with the third wave, and maybe we'll just show a couple of images as well here, just to give a sense of what's going on. First off, this is looking at Ontario, but I think this is actually very much what we're seeing BC through Quebec in those provinces, where this was our second wave, and this orange line is where we are in the current third wave. So we are almost back to where we were at that second wave, and unfortunately, things are still on their way up. And of course, the reason we're so worried about that is because as cases go up, people being hospitalized goes up, which is exactly what Dr. Khatib was talking about, where the hospitals are being overwhelmed. I know she works at Sunnybrook, and this is something actually the Sunnybrook Hospital is doing in one of their parking lots, is basically building a field hospital because they are not going to have enough room for their patients. And so that's the real seriousness of what we are seeing. There are so many people getting sick from COVID-19. Fortunately, most people who get COVID-19 are not going to be severely ill, but a minority, and a growing minority, does get severely ill, does need to be hospitalized, and our hospitals just can't handle the volume of people who are going to be hospitalized. As Dr. Khatib mentioned, we have variants now, and we can see here that the variants are much more serious, about 50% almost greater risk of being hospitalized, getting close to double the risk of being in an ICU, and a good 40-50% greater risk of potentially dying from COVID-19. And so really, I think as we get into Ramadan, the key part here is we want to make sure we're doing what's going to make sure we keep our community safe. The way COVID-19 spreads is when we have close interpersonal interaction with each of us. The whole idea of the lockdown and everybody staying at home is that we all stay away from others, and therefore the infection can spread and it dies out. And we saw actually last year when we did that through March and April and the early part of May, we actually ended up with a summer where there wasn't much infection spreading around. And we really need to do that again. And unfortunately, that is at a time where normally during Ramadan, we'd be getting together for iftars, we'd be getting together to pray together. Unfortunately, we can't do that in person this year, and we need to find ways to do it in other ways. Unfortunately, we live in a time where we have remote technologies like this where we are able to do that. And so I think the big message I think we should all take away is try to find ways that we don't interact this year. We do our part to stop the spread of infection. And in a few months from now, when more of us have the vaccine, we'll be in a much better place. And hopefully we'll all be safe, healthy, and able to partake in the better situation then.
Jazakallah. Thank you so much. And just on that thought, I want to perhaps pose the questions about the vaccines themselves. So, can both of you perhaps elaborate on the importance of getting the vaccine, and I perhaps we can explore various aspects of getting the vaccine, but can you maybe expand on just the importance of getting it, and Ramadan is at our doorstep, and what we can do to kind of like make sure that that's in place for us. We'll definitely touch on fasting and the vaccine while you're fasting, but can perhaps one of you or either one of you address that?
I can begin. I think Dr. Khatib showed earlier some of the statistics, including the number of people who've died from COVID-19. And first and foremost, the reason we want to get the vaccine is because it protects us from dying. It protects us from being one of those people who's going to be severely hospitalized. We're actually really fortunate in Canada that thanks to the brilliant scientists around the world and the grace of Allah, we've developed 4 vaccines that are licensed in Canada that are effectively 100% able to stop us being hospitalized, effectively 100% able to stop us from dying from COVID-19. And so if we get that vaccine, we're protecting ourselves so we don't have those outcomes. But even more importantly, we're preventing ourselves from getting infected and spreading it to someone else in our community who might be even more vulnerable, or to a parent or a family member, someone else who's really important to us. So that's, I think, the first reason that we want to get the vaccine. It's basically protecting us. It's protecting those around us. The second reason, though, is, we've just talked about how we had a lockdown last year. We, of course, had another lockdown for many of the provinces in December, January. We're, of course, entering new lockdowns now in much of the country. And we're going to continue going through that cycle of having repeated lockdowns unless we do something to break it. And the way we break that is by getting the vaccine so we have immunity. And so those lockdowns will no longer be something we have to experience. And so next time we have an important celebration or an important month, or we have our next Ramadan, we're not going to be worried about being in a stay-at-home order or a lockdown where we can't come together for iftars. And so that's the second reason why we want to get the vaccine. It's doing our part to bring this pandemic to an end and help everybody get back to something more close to normal.
Absolutely, absolutely. You could not have said it better. Right now, the most important thing you can do is get the vaccine when you're eligible to get the vaccine. All right? That is your best bet at surviving COVID. And exactly what Dr. Hijri said is that the reason we have vaccines is not just to prevent a disease, it's rather to save us from dying from a disease or being hospitalized from that disease. Okay? So all the vaccines do that well. We'll get into the details about that. So the best thing you can do is, as soon as you're eligible, get the vaccine in your arm, develop the antibodies, let your body help you, protect you from COVID-19 so we can get through this together. And that is the best thing you can do, and physical distancing and wearing a mask and all the things that we already know this year. And of course, washing your hands and using hand sanitizer. But the importance of getting the vaccine now, more important than ever, right? More important than ever. It's available. It's here. You're soon going to be eligible. More important than ever because wave 3, as we've clearly showed, is rough. All right. So definitely echoing what Dr. Hijri had said.
Jazakallah, thank you so much. And on that note, I'm wondering if we can maybe, bring in Sheikh Zahir to expand on some of the challenges we're facing in the community. So, individuals are talking about, I'm fasting, it's Ramadan, I have an appointment to get, my vaccine this afternoon, and I'm afraid that I'm going to miss a fast. because I'm going to have a high fever or I'm going to have some symptoms and I want to put it off. It's Ramadan. I want to get my fast in, perhaps, there's sacrifices there, but I don't know. I don't know what to do. So that's one aspect that, I'd like us to perhaps address. What should someone do, in terms of getting this vaccine while they're fasting? Will it break your fast? I think that needs to be addressed as well. And Sheikh Dahir, you're the best person to answer that. So let's begin there. If you took the vaccine while you're fasting, would it break your fast?
Bismillah ar-Rahman ar-Rahim. No, it wouldn't. So we're encouraging those who are eligible for the vaccine to take the vaccine. Many of the fatwa councils in the world have stated, and it's from our books, our classical jurisprudence books, that it is permissible to take a vaccine while one is fasting without it breaking your fast, simply because the vaccine is going into your muscle or into your vein. It's not going to your body cavity. If it enters your body cavity and it's for nutrition, then it breaks your fast. But this is not the case. The vaccine is given. I had it myself a couple of weeks ago, and it's given in your upper arm. So it does not break your fast. Now, the second thing about it is that as if you do take it and you have severe symptoms, it comes, perhaps you have pain or whatnot. My parents took it, they had pain in their arm. They did not have to take any Tylenol or Advil for it. I took it, I did not have except a sore arm for half a day. So it may vary from people to people. The doctors on this here right now, Dr. Al Khatib and Dr. Tariq, they'll know more about what type of effects you can have. However, if you do have effect and you're fasting for that day, if it's unbearable, meaning that the pain is unbearable or the symptoms that you have is unbearable and it would lead you to increase in the sickness or the severity of what you're feeling, then you have to break your fast. This is a known that you have to break your fast. If it's slight pain or whatnot and you can bear with it, that means that you can bear with it, and you don't have a long left for the fast and you can bear with it, then continue fasting. But if you need that advice, contact your family doctor, contact the medical profession and ask them what their advice will be accordingly to the symptoms that you're facing, because they will know your medical history. But on a whole, taking a vaccine during fasting does not break your fast. When it's time for you to take your vaccine and you're comfortable with taking it, please go out and take it. Do not make the fasting prohibit you in taking the vaccine. Thank you.
Any comments from our medical experts, please?
Sheikh, I wish you were here a few days ago when my mom came to get her vaccine. She fasts, mashallah, every Monday and Thursday, and she made me make sure that her vaccine is not on those days. And I tried to tell her that our duty to get this vaccine is very important as Muslims, to get this vaccine and protect our community. And as much as I tried to say, Mom, it doesn't break your fast, just the fear of it possibly breaking her fast was too big of a deal. So I thank you for sharing this with us and for explaining to our community this, because especially with Ramadan, like the Monday and some Thursdays, they're Sunnah, but with Ramadan, people are going to have that bigger fear. And it's great to know straight from you that it is okay to take your vaccine when you're fasting. And if you can comment on our duty as Muslims to try to protect our community with the vaccine, that would be much appreciated as well.
Yeah, thank you, Dr. Noor. Part of our civic duty is, the Prophet ﷺ, our Prophet, he says, La darar wa la dirar. There's no harm or reciprocating harm. So, and one of the principles of our faith is protection of life. Not only protection of our lives, but protection of those who are around us. It's a civic duty that we have as community, that in the time, and we all, when there was a pandemic in the time of Umar al-Khattab, radiallahu anhu, he said, do not go to that city. And if you're in that city, do not leave so that it can spread. So now it's important for us to understand the significance of the vaccine, and it has been proven by the millions of people who have taken it that it has reduced, as far as I've read, and my friends who are medical doctors in the UK, it has reduced the amount of people in their elderly ages going to the hospital. It has reduced it significantly. And so it had been proven that the vaccine is now is working on that. There's fewer people entering the hospitals in the UK, and they've had a massive vaccination effort over there. So what does that say to us is that we should not want to be carriers so that we may infect other people. We want to protect ourselves, but at the same time, we want to protect others. In 1717, in the Ottoman Empire, when they developed the vaccination for smallpox, the Ottoman Empire took it to people to get it. And they took it across the Islamic world, and they said, you have to take the vaccine because of the devastation of smallpox was having on the communities. And so likewise, if we see what the great scholars of the Ottoman Empire said at that time, we would see that we should, if we are now in that realm in which we are able to take the vaccine, then we should. Obviously, there are those who are accepted, the autoimmune, the compromised people of autoimmune, and so on and so forth. The doctors will talk about that, right? But we are encouraging, we're not forcing, because we can't force you. We're encouraging you from an Islamic point of view to please go out and get the vaccine. This is an encouragement. It's an encouragement. And our imams and councils across the world, fatwa councils across the world, have been encouraging people to take the vaccine from, Pakistan to Malaysia to the Arab world and to here, the European Council and the North American fatwa councils. We have been encouraging our community to go out and take the vaccines. They are safe. From a halal perspective, they are safe. And there's fatwas, legal opinions about it. So, let's do some of our let's do our due diligence, inshallah, and protect our elderly and protect our community and our society.
So just I want to jump in here just very quickly. Thank you so much, Sheikh Zahir, for that beautiful explanation. We're definitely contending with a lot of decision making, and some of the questions are now coming in, and I want to be able to get to some of them before our time slips away. And so somebody's asking more specifically that they got the first dose of the Moderna vaccine. It's recommended that they get the second dose after 4 weeks, but current timeline suggests the second dose might be given after 16 weeks. Does that undermine the effectiveness of the vaccine's, effect, like just potency? How does it work? How do these vaccines work?
I can maybe start off by answering that question. The first thing to note about a vaccine is when you're getting 2 doses, you get most of the benefit from that first dose, and then that second dose is really just topping things up. So 95% of the benefit you're going to get, you've already got from that first dose of Moderna. So that is really great. The second thing we know actually with a lot of vaccines is that if you get that second dose later, it is actually sometimes more effective than getting it earlier. When they did their clinical trials on the vaccines, they wanted to get a vaccine approved very quickly, so they chose a very short timeline of only 4 weeks. We hasn't studied what it would be longer, but for most other vaccines we know, when we stretched out longer, it's the same effectiveness, or it might even be better. And actually with the AstraZeneca vaccine, they did actually test out 3 different schedules for it. They did it at 4 weeks, they did it at 8 weeks, and they did it at 12 weeks. And they found it was very effective at 4 weeks, but even more effective when it's spaced 8 weeks, and even more when it's effective when it's spaced out 12 weeks. So there's very good reason to think that when you get your Moderna vaccine at 16 weeks, at the very least, it's not going to be any worse than if you got it at 4 weeks, and there's a chance that it actually might be better. The reason we've spaced out the dose to 16 weeks is really about making sure we can protect our whole community. So if, say, we have 100 doses of vaccine, we give 50 to 50 people, and then we give the other 50 to those same 50 people 4 weeks later, we've got 50 people in our community protected. If instead we use those 100 doses and give it to 100 people, that means that 100 people now at least have some protection. Maybe everybody doesn't have the best protection, but they're 95% of the way. And having 100 people 95% of the way is better than having only 50% getting a full protection. And so that's the reason why we've done it. By doing this, we're able to actually get vaccines out to everybody, hopefully in the next few months, before we go back to second doses. And that'll mean we'll keep the entire community safer as a result.
Great. Just on that note, can you say, Dr. Hirji, if there's any specific difference? I mean, people may be holding out for one vaccine as opposed to the other, and so during Ramadan, compromising or just maybe increasing the risk of contracting COVID. So is there a major difference between Pfizer or Moderna or AstraZeneca where people are holding out? Like, could you maybe comment on that or suggest?
Yeah, I'll briefly comment on that, and I'll then actually turn it over to Dr. Khatib, who actually has some actual slides and graphics to show this. I mentioned early on that we have 4 vaccines licensed in Canada, and all 4 vaccines are effectively 100% effective at preventing hospitalization, effectively 100% effective at preventing death. And so all 4 vaccines are excellent. There's very little to choose between the different vaccines. The only difference that we see a little bit is maybe some of the vaccines you're more likely to get a mild cold or sniffles than another one, but even that is questionable, and the more we're studying the vaccines, we're finding is maybe less and less of a difference. And I'll pass it over to Dr. Khatib to talk a bit more about this.
Sure.
Absolutely. So thank you for that. So efficacy rates, everyone's talking about these numbers. The first thing someone asks me today I was working in the vaccination clinic, I got the question, what am I getting? Almost every time. The truth is, the best vaccine for you is the one that is in the syringe right now that you're about to get. That is the best vaccine for you. The one that you're going to get as fast as possible is the best one for you. When you look at these efficacy rates, is 67% worse than 95%? Logically, yes, but no. These studies on these vaccines were done at different periods of time. The Pfizer and Moderna one was done in the summer. We had less variants in the summer. The AstraZeneca and the Johnson & Johnson one was done later when we had more variants and actually higher rates of COVID in general. So these efficacy rates are not as important you can't compare them head to head. You just can't. It's comparing apples and oranges, really, because they were done at different times. What you need to focus on is what matters. Which vaccine is going to keep me out of hospital and which vaccine is going to keep me alive? And all of them do a very good job at keeping you out of hospital and keeping you alive. Okay? So whatever is available to you, go and get it as soon as you are eligible. If we look at the vaccines head to head, these are the 4 approved in Canada. We see the first thing people look at is the efficacy rate, the first line there. These efficacy rates are changing. Why? Because when you look at, let's say we're studying AstraZeneca in the US population, the efficacy might be different from other populations, ones that have maybe more variants, ones that have higher rate of COVID in general. Of course, the vaccine is going to be more effective if there's a lower COVID rate in the area. Do you see my logic there? Lower COVID rate in the area. Of course, more people are going to be that you vaccinate are going to have less COVID, right? But more importantly is the 100% value. That's what I'm looking for. What's bolded right there. Very important, okay? In terms of how vaccines work, because I get this question all the time, the Pfizer vaccine and the Moderna vaccine are mRNAs. So what that is, yes, it's a genetic kind of material, but it's not DNA. It will not alter your DNA. Absolutely impossible to do so. What mRNA is a map, okay? The vaccine is giving your body a map to create a protein that is on the COVID-19 virus. So it's a map to create a protein. It does not have the virus. It does not have any DNA type of material. And your body is the one that's is bringing out these soldiers, the antibodies, to fight COVID-19. Your body's doing it. The vaccine is just giving your body a map. So that's the Pfizer and Moderna. For the AstraZeneca and J&J vaccine, we're looking at there's a virus in there called the adenovirus, which is not going to hurt you. It's like the common cold virus, and it has material also for the spike protein, or the protein that's around the COVID-19 virus. So again, your body sees the adenovirus that's in the vaccine, learns how to fight COVID, and that's how all four work. All right. It's a miracle of science. We are very blessed that this has happened within a year. I guarantee you there were no shortcuts. The shortcuts were in the bureaucracy and the funding that takes time and years for vaccines to be developed. But the actual number of participants and the actual studies were rigorous studies. And we would not be recommending these vaccines if they weren't.
Right.
In terms of the big question about the AstraZeneca vaccine, today I had a lady tell me, "Oh, thank God you're giving me Pfizer, because if it was AstraZeneca, I would walk right out." And I just I just sighed, because I don't want people to think that it won't be protecting them. It'll be protecting them from hospitalizations, from death. And in terms of the blood clot risk, look at here. Serious harm due to the vaccine, 11 in a million for 25-year-olds, and less in 55-year-olds. Getting hit, God forbid, getting hit by a car and dying, 38 in a million. 23 in a million for 55-year-olds. Okay, this is to put in context what the AstraZeneca vaccine and the risk of clot is. Very rare. Okay, very rare. And if you are risking leaving the house and crossing the street, then that is way riskier than taking the AstraZeneca vaccine. Okay, we hear all this media, we hear all of this, because this is, for the media, this is great news, right? Because it's news that will grab people's attention. But step back and listen to the actual science. Listen to it broken down in terms of relativeness. Here's some more relativity. The AstraZeneca vaccine, there's 4 cases in a million vaccines that caused blood clots. All right? Look at that percentage, 0.0004%. The birth control pill, which is ubiquitous, right? Higher than that. Smoking, higher than that. You are more likely, God forbid, going to get an infection from COVID and get a blood clot than you would have ever had you take the AstraZeneca vaccine. So if you are willing to risk getting COVID and then getting a blood clot, then you will get that. If, compared to the AstraZeneca vaccine, the risk is much higher to get COVID and then get a blood clot. So if your fear is blood clots, then get the AstraZeneca vaccine, or get any vaccine, so that we can prevent COVID, so we can prevent blood clots from COVID, because that 16% value is quite high. So I just wanted to give you an idea of how these vaccinations compare and how important it is to really get what's eligible, get the vaccine that you can get as soon as possible, inshallah.
Thank you. Thank you so much. That's exceptionally, putting it in perspective like that really does shed light on the reality of what we actually don't know. And those numbers are just shocking. I'm curious about Ramadan and what people are going to be doing. Going to the mosque, not going to the mosque. I wanted to just maybe get Sheikh Zahir to kind of weigh in here, and what his thoughts are. Perhaps share some of his understanding of what other imams are discussing in terms of Tarawih, people breaking their fasts or trying to make salah at the mosques. So it's a little bit of a broader discussion, and certainly taking that discussion from the mosque into the community, people's homes. So if you have the vaccine, and then there are those that don't have the vaccine, what are your thoughts, Sheikh Zahir, about encouraging people to come to the mosque? and first of all, will you be offering Taraweeh? Is that even something that's going to be entertained? Would you encourage that? Just what are your thoughts about that?
Okay, Bismillah Rahman Rahim. This is a wide topic and probably one that will have a lot of debate depending on the province that you're in, depending on the particular imam that you ask, depending on the board of directors of the mosque that you have, and the circumstance, depending on the hot zone that you're in, depending on the part of the city or part of the region that your masjid is in. It all depends on what you know of your congregation. Is your congregation filled with elderly people? Is it less? Do the congregation abide by the stipulations, by the protocols? Not in the mosque, because of all the masjids that I know of, all of them have followed the protocol: 6 feet distances, wearing a mask, the wudu and the washrooms are closed, except in emergency when someone comes and they need to use the washroom, which is it's sanitized afterwards, and so on and so forth. So I know that this is what's happening in our masajids on a whole. The question to the mosque to ask themselves is, are they in a hot zone? Are the congregation taking it seriously or not? When they go outside, are they gathering in their parking lot? Are they talking? Are they going? Do they do this? Do you have to remind them to even wear their mask and not to gather in their parking lot and have a fruitful discussion about something or whatnot? So it is up to every masjid to decide what they want to do. We know in Ontario, I'm in Ontario, that the provincial standing is 15%. Now, there are some mosques in the GTA that have remained closed and are closing. There are masjids that are opening up and they're abiding by that 15%, whatever it is. There are masjids who are having 5 daily prayers, Jummahs, and then Taraweeh. There are masjids who are electing to do less than that. Why the difference? Because they all understand and they know their congregation, and they all want to protect their congregation. Now, we know what the provinces are saying. All of us understand the percentage in the provinces. Now, the provinces are saying one thing, but we know sometimes the reality on where we live. In the books of fiqh, particularly in some of the books of fiqh, when issues come up that require the expertise of others, the fuqaha, the scholars of jurisprudence, go to those people of speciality. So when it comes to agriculture, what should be planted, how often it should be planted, when do you turn the earth, and so on and so forth, it is in hands to seek the advice of people of agriculture, the farmers. When it comes to matters that pertain to health and the welfare and the physical well-being of a person, some of these matters are put into the hands of the medical specialists. So for instance, in our books of fiqh, this can go on, right? For instance, Ibn Abidin, the great Hanafi jurist, when women want to fast in the month of Ramadan and they're expecting a child, they're pregnant, or they're breastfeeding a child, and they want to fast or not, and they come, that ruling of whether they should continue fasting or not, or fast, is in the hands of the medical professional, he says. Many of our books of fiqh say this, that there are matters that are in the hands of the medical professional. So I'm going to ask, so for me, if the masjid, and we discussed this on our council, that some of the imams felt that because Salatul Taraweeh is a sunnah, and we have geared our congregation to pray the fara'id, only pray the fard, then let us pray the fard if we have to, and let them pray the sunnah, let them pray Taraweeh in their homes, because it's a sunnah to pray in their homes as well. So some of the imams have discussed this issue also, and have come up that this is a fair thing to do. Other imams in our city, in the GTA, have decided to actually close the masjid, because they understand their congregation, they understand they're in hot zones and hot spots, and they understand the difficulty of that community getting to vaccinations. So what I would like to do then, without giving an opinion, I would like to then ask Dr. Al-Khatib and Dr. Tariq what their opinions are on this matter, because they know what's happening in the hospitals and in the hot zones. And they see what's happening in terms of, I read a very disturbing news articles today about the number of patients that are being transferring from the GTA to other hospitals without their consent, that they don't need their consent to transfer, which means that there's something really significantly happening in the hospital. So let us talk to Dr. Mustafa and Dr. Al-Khatib, inshallah.
Great. Any comments from the doctors with regards to that? Please go ahead.
So thank you so much, Sheikh Zahir. Bismillah ar-Rahman ar-Rahim. This is a controversial topic, so the honest truth and the brutal truth is, as you know, mosques are allowed to open up to 15% capacity, if I have got that correctly.
That's right.
So I can guarantee you that if we open at 15% capacity and we are indoors in an enclosed space and we are at that 15% capacity, someone going to the mosque, even though we are doing everything possible, could die from COVID-19 for the fact that they went to the mosque that night for Taraweeh, for a prayer, and that is a very possible reality. And every time you think, oh no, but I really should go, they're open, they wouldn't be open if it wasn't safe. We know that that's not the case over the last year. We know that things have opened, even though it wasn't safe. They're allowed to be open up to 15%. But the truth is, if you want to keep yourself protected and not harm others, then you do not go to the mosques. I guarantee you, going to a mosque, someone will, God forbid, but someone will die of COVID by people congregating in mosques, even at 15%. COVID is at its worst in an enclosed space. That's where COVID is at its worst. And in a mosque, we are in an enclosed space. Unless we're praying outside and we're 6 feet apart, then that's a different story. And if we're talking about cities like Toronto, Ottawa, Calgary, cities where COVID is everywhere, then it is not a good idea. And really, I'm going to just say, no, do not go to the mosque. And that's the blunt truth medically. And I know it's hard to hear because this is our precious month. This is the month we look forward to all year. And we want to go to Taraweeh. But think about the fact that you might be harming someone is not worth it.
Thank you. Thank you so much, Dr. Al-Khatib. I really, really, really appreciate your candor and just your honesty with regards to this. We are in very dire times. We are in, as you began the conversation earlier on, the first wave, the second wave, by far, we are in the worst stage of this pandemic and cannot stress how serious it is. And there's this delicate balance. I do want to get some feedback from Dr. Hirji just in a quick second by posing this next question. And that is, with social gatherings. So, for example, last year I heard of an interesting story about, someone who had COVID positive, was invited to an iftar, could have been outside in someone's backyard, didn't want to be culturally, despondent or like, didn't want to have, any shame or guilt associated with declining the invitation, didn't want to be ostracized. So actually went, and didn't tell people that they had COVID, and it became a super spreader. So Dr. Hirji, can you contextualize, with our cultural obligation to, host and exchange, and, so my family has the vaccine, but your family doesn't, and I'm going to invite you anyway because we're protected. Like, can you please maybe expand on that dialogue, please?
Yeah, so I'll just maybe first, before I go forward, just agree 100% with Dr. Khatib said about the importance that we really do stay home. We just went through a few months where provinces were trying to open up, at least from BC through to Quebec, and they had capacity limits. They had all the different measures to keep us safe, but that wasn't enough, and we are nonetheless heading into a third wave. And I think there's sometimes a balance that government is trying to find where they're trying to support the economy and businesses while trying to balance it with health. And unfortunately, we've seen with the variants that that balance just isn't one that's reached. And if you actually put this slide up that I have here, I just want to quickly illustrate what we're seeing in many of the provinces in Canada. So, I'll start off with a line showing what things in Ontario, where we have this. Our third wave is very much mirroring almost where we were at the second wave and on its way still up. If we draw in Quebec here, you can see Quebec is similarly with a line trending upwards. I'm going to delete the Quebec line as I go here, but this is Alberta here, and you can see that they're basically exactly mirroring us in Ontario with the lines trending upwards. Manitoba, you seeing they are maybe starting to trend up a little bit. Saskatchewan here, they're heading upwards. Really, from BC all the way through to Quebec, we're seeing this very consistent pattern that we are heading into a third wave, and in almost all the provinces, it's looking like it's going to be worse than the second wave. And because of how bad it is, because of those stories we're hearing about our hospitals, and Dr. Khatib is seeing this right in the front lines in the hospitals, we need to do everything we can to stop the spread of infection, which means I think we don't want to take the risk with being one of those 15% in the masjid. We want to make sure we just stay home and limit the experience. I do want to say that if you're in one of the Atlantic provinces or one of the Northern Territories, the situation is a little bit different there, where they're not necessarily seeing a third wave. This is what Newfoundland, sorry, that was Saskatchewan. This is what Newfoundland here looks like, where you can actually see they've been pretty close to zero all along, and they're back to zero. They did have one big outbreak linked to variants, but they actually managed to suppress that. And so in the Atlantic provinces, the Northern Territories, I think there might be opportunity for you to perhaps have some gatherings. And I encourage you to listen to who are your local public health experts, because they will be able to tell you what's best to do in your regions. Getting back to the other part of the question, really about gatherings. I mentioned up front that the way COVID spreads is when we are together. And so that is the absolute reason why we don't want to be together for this month, even though it is such an important part of this month. We want to make sure we're keeping everybody in our community safe. If you've had the vaccine, that's great, and it's really important, as we've said, to get that vaccine. But no vaccine is 100% effective. And we also don't want to start to create, this sort of two-tier element within our communities, where some people are able to partake in activities and other people aren't. I think all of us are going to be best able to stay home and continue to experience Ramadan from home if we all do it together. We're all in the same boat. We're all acting as one in doing that. And I think it really breaks down some of that social cohesion if we start to create two classes of citizens, one who is vaccinated and they can go do things, and the other who is not. Right. And so I would really encourage it, even if you're vaccinated, it's great, you've done the right thing, you're protecting people, but it's not 100%, and we want to make sure we keep that consistency across our society. So please continue to follow all the same precautions as everybody else.
Excellent. Thank you so much. So we've got a few questions that have come in from our public, and they're going to be just a little bit more rapid fire, quick kind of response, because we want to make sure we answer people's questions. So there's about 5 or 6 of them, and I encourage people who are listening right now to please text your questions in our YouTube or our Facebook. Let us know what's on your mind. Our experts are here to answer those questions. So one of the questions that have just come through is, what is the difference between the COVID vaccine and the flu vaccine? I just took the flu vaccine last year, so is it okay to maybe take the COVID vaccine as well? Like, can I layer this? What are your thoughts, Dr. Al-Khatib?
Thanks for that question. So just to clarify, someone took the flu vaccine maybe at the end of last year, and now they're wondering when they can take the COVID vaccine, right?
That's right. Yes.
So I get that question all the time. If you've taken a vaccine in the last 2 weeks, then you shouldn't take the COVID vaccine, but it's not contraindicated. All right. So if you've had the flu vaccine in October, December, you are perfectly fine. We're talking in the last 14 days. And actually, just today, I had someone who had their pneumonia vaccine 12 days ago and really did not want to postpone to the 14 days because you're supposed to get your COVID vaccine 2 weeks after you've gotten another kind of vaccine. Okay. So even at 12 days, I told her it's not contraindicated, but you probably will have a better effectiveness if you wait the 14 days that's recommended. And she took the COVID vaccine. So again, it's not contraindicated, but if you took the flu vaccine at the end of last year, don't worry about it. You can definitely get your COVID vaccine.
Awesome. Great. The next question is for Sheikh Zahir. So why are some mosques not posting on their website and, like making, constant announcements, encouraging members, at every opportunity to go get the vaccine? Like, why isn't that happening? Just your thoughts.
My thoughts on it, as far as I know, we're making regular announcements. I have been.
Yeah.
The Canadian Council of Imams have been making announcements, and our imams have been making announcements to, we're recommending people. Some of our masjids, like I'll name them, like Tariq Masjid has had 2 vaccination clinics. Dar es Salaam in Scarborough has had a number of vaccination clinics. So our masjids, like SKC, ISNA in Mississauga, I know others in other provinces. I'm sorry, I don't know your names, but I know we have all stepped up to the plate and said we're welcoming vaccination clinics to happen in our masjids, right? For not just our community, for the wider and larger community. Let's get people vaccinating. So by seeing that our masjids are willing to open up vaccination clinics and to service our community that way is a sign enough. I can't speak on behalf of all masjid why they're not posting it or why they're not mentioning it. I believe they are. The imams are encouraging people. If I can go back to close the loop on that question about masjid opening or closing, even though the provincial rule may be to open up at a certain percentage. I'll tell you a personal story. There's a gentleman, an elderly man in our masjid, my masjid. For the last 5 years I've been at this mosque, he's been there at the first row every single night. All throughout, Fajr, Isha, Dhuhr, Asr, all night. When we opened back our masjid, I missed him. 1 month, he didn't come. 2nd month, he didn't come. I was asking people. They told me that he got COVID. This is a 65-year-old man. I called him. He said he's fine, and so on and so forth. He recovered, but it affected his lungs, and he has permanent damage in his lungs. Last Friday, we opened up for Jummah at a reduced rate. It weighed on me to open it up. It weighed on me and the board of directors of our mosque. When he left to see me, when he was at one part of the mosque and he came to see me, it was 3 meters away that he came. This is 2 months ago when he got over it. On this past Friday, when he walked 3 meters, he was huffing and puffing. It broke my heart. I have to tell you, it broke my heart. Why? Because I know him. This is the masjid that he attended. I felt guilty that perhaps, did he catch it from our masjid? Did he get it from coming to our mosque? It weighs on me. It weighs on me. Any of the imams, I know it's weighing on us. It weighs on us. I understand the pressures of the masjid. There's donation, Ramadan. That's the time that you get a lot of your donations in. It's spiritually uplifting to the community and so on and so forth. What does it weigh on you, though, if someone gets sick and you don't see them again in the masjid? To me, that's how I think. If I'm wrong at thinking about this, then please, but this is my thoughts. I'm representing my thoughts, right? This is me. It weighs on me. So the coming day or two, I'm going to meet with our board of directors and we're going to decide, and perhaps we'll decide something that will be hard for us to do, but we will probably have to do it for the benefit of our community. That's us.
Thank you.
So my advice to the masjids is carefully consider what you have to do. and listen to our medical community. That's my advice to you.
Thank you so much, Sheikh Zahir. I understand, how difficult it's put, not only families who have lost loved ones, there's a lot of loss in our community, not being able to socialize, loss of, standards of education, loss. So, and now as Ramadan is approaching, that very essence of what brings us together, that's also, straining our relationships. And so, a lot of the worship is more, within our families and more internally driven, and looking at our spiritual connectivity as individuals to our Creator, and serving as an opportunity for reflection during this time. Another question that's just come in, and a few more, if I can just, I know we're at the 9:30 mark, but with the speaker's permission, we're just on a roll here. Can we just maybe go another 15 minutes with your permission? I'm just asking. Thank you. Thank you so much. So one of the questions is for Dr. Hirji. So if someone survives COVID, can they still get the new variant? Like, can they actually catch this new variant even though they survived COVID? Is that possible?
Yeah, unfortunately, we do see people who get COVID a second time. We actually have seen it even without the variants, with just the usual form of COVID, where occasionally it's happened, but we're seeing it much more frequently with the variants, where someone has COVID and then 3-4 months later, they now get the variant version of COVID, and so they are sick again. And so it's absolutely a risk, and one of the reasons why, even if you've had COVID before, you really need to keep practicing all of those measures that keep you safe and keep everybody else around you safe.
Excellent. Thank you so much. And so now this is a little bit of an interesting question because it kind of goes across our borders, but I think the individual who's asking is maybe trying to seek a little bit more clarity. So the question is, why are we still seeing a rise in cases in the U.S., even though the vaccine is currently being, disseminated, it's being used. People are getting shots. We see, increase in the uptake of sites across the U.S. So why are we still seeing a rise in those cases? And is it proven that they work with the new variants? So any kind of research on that? And can you maybe share some resources? So this is what this individual is asking, a little bit more detail, maybe just some explaining or just expansion on some of those concerns.
So the concern, it seems, is that the cases are rising despite the vaccine.
Yeah.
Now, the cases, I get that question for Canada. And I get that question like, how come we're seeing sicker and sicker people and we're vaccinating more, right? If you remember my slide at the beginning, we had 7.5 million doses. We were about 39 million Canadians. The people who got vaccinated first are people above 80, right? And then we moved to 70, and now we're moving to 65. These are not the people we're seeing in the hospitals anymore like before.
Yes.
We're seeing people who are younger, who do not have their vaccine. So people in their 20s and 30s, or people who had their vaccine.
So I think we've just lost Dr. Oh, there she's back again. Great. Maybe we can pick up. Sorry about that.
No worries.
Dr. Khatib, sorry about that. Please continue. Please
no worries. So what I was saying is that basically we vaccinated above 80 and above 70 and now above 65. Right. But the people who are in the hospitals right now are much, much younger. So this is why there's a disparity. People who didn't believe in vaccines messaged me going, hey, so how come this is happening? Well, this is happening quite logically because of the different people we're vaccinating. But inshallah, when we do vaccinate everyone and when we achieve that herd immunity, the cases will surely be less.
Okay. No, thank you for explaining that. And Dr. Hirji, any comments on that, or are we good to?
Yeah, so I think the key thing to note about the US is they've been vaccinating, but they've only vaccinated about 20% of their population, pushing to 25%. So there's a lot more people who are still vulnerable to COVID, and so a lot more people could still get sick. And I just want to actually just show this quick graph here of what we're seeing in Niagara. these are different age categories, and what we've seen, of course, the second wave, all the different ages went up. They've come back down, and you can see many of the ages are going up. The 20 to 39 age group here is going the sharpest. But it's really interesting here that this red line for the 80 plus is going up at all. Back in the first wave, that red line was the highest. In the second wave, it was pretty high. This third wave, it's not going up. And that's because in Niagara, we actually have 92% of our 80 plus age group already vaccinated. And that vaccine is meeting, even though most of them only have one dose of vaccine, they're not getting sick this time around. So that's great news. The problem is that we still have a lot more to do before we've got these groups vaccinated.
Great. No, I appreciate that. That makes it very realistic, and that data is so valuable in conceptualizing, what's happening in definitely in the community and across Canada at large. So just one other question is that, with regards to somebody publicly is asking, do we want to, where there's a lockdown, where we're not allowed to go out, we're not allowed to, socialize with good reason. I'm wondering, our guide, the Ramadan guide that we've put forward, definitely says, there are some key practices that you have to put in place where if you're going to the mosque, but predominantly if you're going anywhere. And some of these listed points are, please wear a mask, register for prayers, at the local mosque if you're going, make sure that you're doing some kind of contact tracing, physically distance, make sure that, there's proper hygiene, you're conforming to the numbers, the sizes of the congregation, that you are, definitely symptom-free. So these pieces are definitely, more the critical criteria that we want people to uphold no matter where they go. So Sheikh, just how do you feel, and what is your particular masjid, doing about these more particular stringent guidelines or rulings or, ways of regulating those individuals that come in, and what would you say to other mosques perhaps to enforce some of these guidelines that and rulings that we've identified in our Ramadan guide?
Well, I mean, I believe that all the masjids who have remained open and have opened up that, have kept to the 6 feet distances. Right. They've laid down idle vinyl or plastic. They've put markers on their rugs. They have closed their wudu and their washroom facility, except for emergency for the washroom. They sanitize regularly after every prayer, and so on. Everyone has to wear a mask within their masjid. So they have done, I believe the masjid, like our masjid, have done what we have to do. We had Peel Health, an official from Peel Health came to our masjid, and they saw what we were doing: contact tracing, the door, the 6 feet separation, and so on and so forth. The signage is up, the posters are up. We asked them at the doors if they're experiencing any of these symptoms, and so on and so forth. Most, if not all, of our masjids have done that. The question obviously relies is that even if you do all of this,
right?
Even if you do all of this,
that's right.
Can you still be affected by the virus? And I think that's the confusion of our community. One of the confusion is, okay, we're standing 6 feet apart. We are observing whether we have symptoms or not, and we're wearing masks. So what's the problem of us coming to the mosque? So again, it's in the hands of the imams and the board of directors of our mosque to not only, if they're going to open up, to make sure that they're very stringent on the rules, very, very stringent, because it's Ramadan and everyone wants to come. Everyone wants to come. And if you're like me, this is allergy season for me. So I have sniffles, I have, a cough, and so on and so forth. It's allergy season, right? So as an imam of the mosque, I'm staying away from my mosque. As I said earlier, where I'm going to discuss tomorrow with the board of directors, we're going to have a meeting that we have planned about what we're going to do because of the rising numbers of cases in our community, especially the community around our masjid. So we may, as some of the other masjids have done, we may actually close, but that will come as decision based on the board tomorrow, inshallah.
Jazakallah. Thank you so much, Sheikh. Really, really appreciate that. So coming in from the public, well, actually there's two that just came in. One of them is, any suggestion, if you're going to have the vaccine this afternoon, you're scheduled to take the vaccine this afternoon, it's Ramadan, hypothetically, we're just playing out a case scenario, and you want to prepare. So, let's say there's something that you can eat, that you can take, prior to that morning, at suhoor time. Any comments on, how to best prepare, just so maybe the symptoms that you may, experience later on is a little bit less, and that you can maintain, keep your fast. I think that's what this question, this individual is asking is there anything you can do differently, at suhoor time, or eat or drink, or, prior to in preparing? And then second to that, what if you miss suhoor? And should you cancel? Should you still take the vaccine? Like, what's your body's ability to withstand that, even if you miss suhoor? So maybe those two pieces of a question, please, Dr. Al-Khatib, please.
Sure, absolutely. Very good questions. So basically, for suhoor, the best way you can prepare, and actually from Maghrib onwards, yes, is stay very well hydrated. This is something we often forget in Ramadan, is after sunset, you need to drink a lot of water. At suhoor, drink a lot of water. Stay well hydrated, okay? Have a light meal at suhoor. And that will prepare you the most. It's really preparing you for fasting the next day will prepare you for the vaccine the next day. So very important for you to definitely stay well hydrated. And if you miss suhoor, I guess that's a personal decision though, to see what your body can go through. I know some people that if they miss suhoor, they get a splitting headache the next day, all day, and they feel really unwell, and maybe a migraine with nausea, with vomiting. So your bodies. Think about how you can withstand it if you miss suhoor or not. Try your best not to. And if you do, don't forget after Maghrib to make sure that you're well hydrated. I think that's my main advice for this question. If Dr. Hijri wants to comment as well.
Staying hydrated is key. I think you should think about what has been it like for you in the past when you've been vaccinated. If you're someone who feels lightheaded, if you've previously fainted, just let the person know when you're going to get vaccinated. They may let you lie down and give you the vaccine while lying down. They will make sure that they don't rush you to get up if you're not feeling well. If you're not feeling well right after you get this shot, make sure you let them know so they don't rush you, and everything should be fine. The one last hint I'll give everybody is that, the biggest reaction with a vaccine is you have pain in your arm where you get that vaccine. And a small thing that can help a little bit, especially right after you get the vaccine, is totally relax your arm. Basically let that arm become like a raggedy doll arm, and that muscle will relax, so when that needle goes in, the injection goes in, it's going to hurt the least amount possible that way.
Thank you so much. So as we begin to wrap up now, and we're going to definitely get to those closing remarks, if you can just bear with me, just taking the very last question. So, based on like what's been discussed, are we hearing, this is the question, are we hearing that, some questions from our audience, more specifically, would it be better to recommend that the vaccine should be mandatory in order to attend the mosque? So that's kind of like a criteria to those, attending. Would the mosque even maybe look for proof of vaccination? So, would it be better to recommend to those, that get the vaccine, that, it's actually a criteria. So you have to have the vaccine, then you can attend. Anybody want to comment on that? An open question, perhaps we can hear from everyone as we begin to close off.
I'll maybe start off. I'm not in favor of requiring vaccination, at least not yet. I think when you require something of people, if they're someone who's not inclined to get it, that can actually sometimes push them away and make them less likely to get the vaccine or do whatever it is. I think there's many people who are just concerned that these are brand new vaccines, they don't know much about it, and they're concerned. And the best way to deal with that is to really engage with them, help give them the information, make them feel more comfortable, and that's the better way of approaching this. If we get there a stage down the road where not enough people are getting the vaccine, maybe it's something we can revisit, but I think it's far too early to do that right now. And I also want to highlight that there are going to be some people who maybe can't get the vaccine because of a medical condition, because of an allergy, and we don't want to exclude them from going to the mosque forever. We want to, find a way that we get enough people vaccinated so everybody who can get the vaccine does get the vaccine.
Sheikh Tahir, any comment on that with regards to it being a requirement to attend or not attend? Any comments on that?
Yeah, I won't agree with that either. Just simply because the people who, like some of the imams, will not be in the category to get the vaccination, because the imams who have gotten it from Peel, this is Peel region, I'm in Peel,
right.
We have gotten it because we deal with the funeral services and we wash the bodies and so on and so forth, even and we handle those who have died because of COVID. And remarkably, I don't know if there's a stat on this, but what we've seen in the GTA is that a lot of our community members have passed away from COVID, a lot. And the masajids who have done ghusl and funeral services, we know the reality of what's happening in our own community. I don't know if there's a stat or if the province keeps stats on what community or what religious background that people have passed away from COVID. But I know, and those who are in that funeral services know that almost on a daily basis, we have gotten our community members who have passed away because of COVID, as well as other things, but COVID being one of the main factors over the last year or so. So because of that factor that we don't, because vaccination is not there for everyone yet, it would shut off even the most healthiest of people who may need that attachment to their mosque in areas that are very that the transmission rate is very low, and the masjid is well ventilated and so on and so forth, and they remain open. You would shut the door on someone who may actually need that spiritual upliftment. They may be living alone, and they need that once a week or once a day visit to their mosque in order to keep their sanity and and to keep spiritually strong. So I would not make it mandatory. No, I wouldn't.
Okay. No, jazakallah to our panelists, and thank you everybody for tuning in this evening. If there are any questions that are unanswered, we definitely will be taking up those questions on our website, and we'll be posting just our website here, on our screen. Closing remarks from our panelists, as we enter Ramadan, which is on our doorstep, and look forward to celebrating with family and loved ones as we move through this holy month. And it's one of deep reflection, and any last words that you'd like to perhaps share with our public and our community, and any thoughts with regards to Eid as well and how we should celebrate. And I'll start with perhaps Dr. Hirji. Any comments, closing remarks?
Yeah. Very quickly, I just noticed a question in the comments about ventilation. And ventilation, great thing that we can improve in our masjids, particularly with filtration. But the most important thing, if any masjids do open up in the coming months, is it's good weather now. Open the windows. It's a free, cheap way that you get that good ventilation. I think as we head for the rest of Ramadan towards Eid, really there's two big things that we want to make sure everybody does. First off, because we're in this third wave at a time when there's great danger from the virus, we all should stay home. We should minimize any kind of social interaction and really ride out these next few weeks, which unfortunately will probably mean the entire month of Ramadan and a bit more, but ride that out in a way where we're going to make sure we stay safe, everybody else stays safe. Ramadan's a time of reflection, it's a time of prayer, and we can find ways to do that on our own. And then the second most important thing which we've talked about is make sure as soon as you get the chance to get the vaccine, go get the vaccine. The best vaccine is the one that you're actually able to get because it gives you protection right away. If you're delaying to getting the vaccine, You're making sure you stay vulnerable to COVID, vulnerable to being hospitalized, vulnerable to potentially dying for much longer.
Thank you so much, Dr. Hirji. And Dr. Al-Khatib, any last comments from you, please?
Well, for the closing remarks, I want to say Ramadan Kareem to everyone. I know that it's been a scary talk tonight. And I know that although we're easing some people with regards to vaccines, we're scaring them a little bit about the wave 3. And this is the reality. But Ramadan Kareem to all of you. And think of this in a positive way, where the positive spin on this is we've been given a gift to, remove the distractions. And remove distractions and just focus on reflection, focus on self-reflection, focus on your religion this month, rather than the distractions of going, visiting, doing this, doing that. We are a collective culture. We really are. But right now, this month, we have to realize that if we truly are a collective culture, and if we truly care about one another, to stick together, we need to stay apart from anyone who does not live in your household. That is how we can stick together as Muslims. And let's be the example of a community who will be able to overcome this virus and show everyone that despite how important this month is with regards to gatherings and Eid, we are able to overcome all of those obstacles.
Fantastic. Fantastic. Thank you so much, Dr. Al-Khatib. Thank you so much. And Sheikh Zahir, please bring it home.
Bismillahirrahmanirrahim. Ramadan Mubarak to everyone. We owe a debt of service to our medical community. Let me start there. And to our health professionals and our frontline workers. We thank them. And for this Ramadan, we should include them in our du'as. One of the first du'as that we should be therein is in that first du'a that we thank Allah for bringing us to Ramadan, another blessed month, and that protect our families and our loved ones and so on, our community, and that Allah reward with a tremendous reward the professionals, the first line workers, the doctors in the medical field, and that have provided service, as well as all of the workers, the Muslim workers who name go unknown, a lot of their names go unknown, that have worked tirelessly in not only in the task force, but task force across the countries in different areas and so on. And last but not least, let's thank our seniors who have contributed by being ambassadors to their friends and their relatives. We all know of our relatives who are seniors that have taken a vaccine, and we've seen light go onto their faces because of that relief of stress upon their shoulders. And then they make calls to their relatives, to their sisters, to their brothers, and to their friends that regularly attend the masjids with them that they can't go now, and they have become ambassadors. And so let's continue that. If our parents are getting vaccinated, let's encourage them to be ambassadors, to call their friends and to call their relatives and to say, listen, I've got it and nothing bad happened and I'm so relaxed now. Stress is off. Let's enjoy Ramadan. Finally, I would like to just conclude that we know there are Muslims who may not go to the masjid this Ramadan. They may live alone. They may be fasting alone. So although we have to keep distance from them, but we can call them and we can reach out to them and we can ask our neighbors and we can, take food to their house, put it on their porch and just say salam from their lawn. That we can do. Or we can support our local restaurants by sending food to their houses, by sending food to them. So we know that this is a month of giving. So we can give in all these ways without coming together and sacrificing the health and the safety of our community. So we can have a blessed, and I know, last year, I have to say, even though the mosque was closed, it was probably my best Ramadan because I listened to the Quran being recited by my sons every night, and it was a blessing. And my neighbors and so on, people were walking. When I go out on the streets before Ramadan, I live in a neighborhood that has a lot of Muslims. When I went out just before Ramadan, I would see people walking on the streets, these kids, and they would just go put food on a Muslim's doorstep or on their neighbor's non-Muslim doorstep, ring the bell, and from the lawn just say, hello, this is what we made tonight. We wanted to share it with you. this is what we have to do. We can be safe, we can be, healthy, but at the same time, we can show our nature of loving and having empathy to one another. This is what our Prophet came. He came down except as a mercy to the world. And as a mercy to the world means that we can give, but that we can be safe at the same time. So, let's include everyone in our du'as, and please let's remember, the frontline workers and our medical doctors like Dr. Mustafa and Dr. Al-Khatib. It's a pleasure, I have to say, it was a pleasure hearing from both of you tonight. MashaAllah. Jazakallah khair to Sister Rafai too, who has done wonderful work as the co-chair, and Dr. Hashim, wonderful work, Sheikh Rifat, wonderful work as part of the COVID task force. I would name everyone, but it will take a long time. But, the task force has done an incredible amount of work, and I'm just riding their coattails. That's all I do. I just ride on their coattails. They're very inspirational. So, include all of the members of the task force in your du'as too, because I remember them. Please remember them in your du'as, inshallah. Jazakallah khairan.
Jazakallah. Thank you all. And Sheikh Zahir, you're such a pillar of strength for all of us in the community. So please, we couldn't have achieved so much without you and Sheikh Rafat and so many of our scholars in the community working alongside of our physicians, making sure that people are safe. And Dr. Al-Khatib, she really nailed it, as well as Dr. Hijri. We want to be safe during this Ramadan. It's paramount. Our Muslim community, and for that matter, our Canadian community, our Canadian family, coast to coast. We are ambassadors. We champion the cause of goodness and charitable relations with our neighbors, whether they're Muslim or not Muslim. And Ramadan is the doors of mercy are open. It's so barakah filled, and so we encourage each other to look after one another, check on one another, remember each other in your du'as. Just closing off now, I just want to say thank you so much, everyone, for joining us. The task force is at your service. We work, alongside many community partnering organizations, public health. We want to encourage people to stay safe. Please reach out to us if there's anything we can do for you. Please let us know. And so you can catch this video later on, upload it to our Facebook account, our website. And if there were any questions that weren't answered, please check out our website. Also for our Ramadan guide and any additional materials, posters, upcoming events. If you want to join our mailing list, if you want to volunteer, please follow us on our social media circles. You can find us on www.cmcovidtf. So that's www.cmcovidtf.com. And if you are an individual or community organization that would like to get involved with our work, there's a drop-down menu that says Join Us. It's a tab on our website, and we'd love to hear from you. May Allah keep you safe during this Ramadan, healthy. May He give you a success and mercy, and have you accept your fast and your du'as, and provide you and us with patience and strength to support one another. Jazakallah. Thank you so much for tuning in, and inshallah we will definitely talk to you soon. Take care. Assalamu alaikum.